Hello, in this video, we'll be going over the origin sites, the insertion site, and the actions of the latissimus dorsi. We're going to be using the skeleton as a reference. Now for the first origin site that we'll be discussing, can't really use the skeleton because it's actually a tendon. It's the thoracolumbar tendon. If you look at an image, it'll be along this area. You kind of see it near the bottom of the thoracic vertebrae and the lumbar vertebrae and into the sacrum. It would be a white mass on the image that you see. It's a tendon that the muscle connects into. The second origin site is the posterior iliac crest along here. So the thoracolumbar tendon, the posterior iliac crest. Then we're going to go to the spinous processes of the bottom 6 thoracic vertebrae, the bottom 3 or 4, depending on the person, ribs, and the inferior angle of the scapula. So to review, the thoracolumbar tendon, which is through here, not actually on the skeleton, but this is where it would be. The posterior iliac crest, right here. The spinous processes, or the processes that stick out backwards, of the bottom 6 thoracic vertebrae, 1, 2, 3, 4, 5, 6. The bottom 3 or 4 ribs, 2, 3, 4, and the inferior angle of the scapula. So 1, 2, 3, 4, 5 origin sites to remember, or at least groupings. Now all these muscle fibers are going to start in these spots, and they're going to come, they're going to gather together, they're going to pass through the ribs, in between the ribs and the medial side of the humerus. They're going to connect into this groove, the intertubercle groove, which is in between the greater tubercle and lesser tubercle of the humerus. So insert in here. And now I'm going to show you the actions of the latissimus dorsi and the teres major. Okay, we're going to go over the 3 actions of the latissimus dorsi and the teres major. Starting in anatomical position, speaking of the glenohumeral joint, where the glenoid fossa of the scapula and the head of the humerus meet, the glenohumeral joint. The latissimus dorsi and teres major will both work with extension of the glenohumeral joint, so bringing it back in the sagittal plane. Adducting the glenohumeral joint, moving in the frontal plane towards the midline. And medial rotation. Medial rotation. This is of the shoulder. Now, for clarification purposes, what we are not talking about is pronation and supination. So you notice my shoulder is not moving when I pronate or supinate. So instead, what we're talking about is medial rotation of the glenohumeral joint or the shoulder. Medial rotation. And just to demonstrate, medial rotation. This isn't from the anatomical position, but it'll help. I'm going medially. Okay. Now when we put all of them together, we'll learn why the latissimus dorsi is known as the handcuff muscle, because we will extend, medially rotate, and adduct, and our hands are on the small of our back, ready to be handcuffed. Now the teres major does the exact same thing. Extension, medial rotation, adduction. It just assists the latissimus dorsi. I hope this video was informative and helps you study.